Hello, and welcome to Wellness Wednesday with Dr. Latoya Wells. I'm here again with you for another episode of Wellness Wednesday. Last week, we talked about the impacts of love on your heart. My topic was let's talk about love. And so I hope that you all had an amazing day. It was Valentine's Day. I hope you were able to show yourself some love and show those that you love some appreciation and love as well. Tonight, we're going to talk about the physical heart and the emotional heart and how we can take care of those things, right? So, when we talk about the physical heart, it's in your chest, it beats, it, pumps blood all throughout your body. And we've discussed, how stress and bad diets and those things can impact the overall heart health. And so tonight, I was doing some research earlier about heart health. This is February Heart Health Month. I don't want to forget that. And in doing my research and looking for statistics and updated data, I came across an amazing article, a really interesting article that talked about the physical health and the emotional health. And so this study was done by a group of cardiologists who looked at many different patients and the impacts of different factors on their heart. So we're going to talk about that tonight. First thing I want to talk about is 5 things that you can do, 5 ways that you can keep your physical heart healthy. And we've already talked about that. We're just going to recap. What really caught my attention with this is that it also spoke to the emotional heart. And so we know that our feelings and our emotions can impact our heart. We talked about broken heart syndrome last week. And so let's delve into 5 ways that you can keep your physical heart healthy. And one, we talked about this, eating healthy. I like to talk about eating the rainbow. So eating foods that have those vibrant colors, the greens, the orange, the reds, the purples, the yellows. A lot of those foods are packed with nutrients and vitamins that are healthy for your heart and your overall body. So eat the rainbow. Another thing is we are in the microwave society, right? We want things quick and we want things fast. And that's the case for our food. I know about myself, I can only speak about me. I kind of got away from cooking. I don't have small kids in my home any longer, and I don't have to cook if I don't want to. My husband knows how to cook, and a lot of times he's doing more cooking than I do nowadays. And a lot of times, a lot of times we are eating out, and so, one of the things that you can do to help maintain healthy heart is by planning, especially when it comes to eating healthy, is by planning your meals, planning your foods. I know a lot of people do food preps. I want to get into that. I have all the containers. I just got to put it into action. But planning your meals, even like if you're going out to eat, make sure you're planning what it is that you're going to eat. Look at the menu ahead of time to see what are some healthy options there, especially if you have high blood pressure or if you have high cholesterol and you have to adjust the things that you're eating so that you're not taking in the extra fats and the extra salt. So plan ahead of time. Meal prep. If you are one who has the consistency and you're able to do that, I would encourage it. I am looking to meal prep so that I can plan ahead to make sure that I'm eating enough of the healthy foods and that I'm not at the last minute trying to find foods because I've ran out of options or ran out of time. And so another thing is healthy diet is key to preventing heart disease. If you know what you're going to eat ahead of time, then you don't have to worry about making those last minute unhealthy choices. If you are planning your meals, again, it takes all the guesswork out of it. And if you're eating the rainbow, also the healthy proteins, low fat, low salt foods, doesn't mean that it's not good into the palate and not tasteful. You just have to be a little creative with it. But each individual is going to have a diet that's different based on their individual needs. So but do it in a healthy way. The next thing is exercise. We talked about exercise previously and the impacts of exercise on the heart. And I've been talking about this since last year in terms of how much exercise we should be getting. And guidelines say that you should have at least 5 days a week where you are performing 30 minutes of moderate exercise or 75 minutes of vigorous exercise in a week to help with your heart health. That's to get the heart rate up and bring it back down so that you're exercising that heart muscle. Our heart is a muscle and it's just like any of the other muscles in our body. Okay. So, but one thing is, we don't want to overwork the heart, right? So when you have a heart condition and your blood pressure is elevated, you have other medical issues going on or cardiovascular issues or heart issues going on that put stress on the heart, it can cause that muscle to get big. While we want that with our physical muscles, right? We don't necessarily want that to happen to our heart. So if you're starting a new exercise regimen or starting to exercise for the first time, or you have a heart condition and you want to exercise, make sure you're talking that over with your healthcare provider first so that they can give you some guidelines on where to start. There's a lot of physical trainers and personal trainers that are popping up on the scene. Do your research before you go and start working with or hire a personal trainer to make sure that they are qualified, that they have the certifications to be able to coach and to work with someone who has heart conditions or heart issues, because not everybody is qualified and not everybody has the experience to work with someone who has medical condition. I can tell you, I went and started working out with a personal trainer at a gym. And when I tell you I have knee issues, and I've shared that before, that individual was not knowledgeable on modifying to the degree that would protect my knees. And I ended up hurting myself. And so you don't want to go and work with someone as a personal trainer and they're not knowledgeable and can cause you some issues. Now, I did go and find a really amazing personal trainer, PJ. I miss him so much. But when the pandemic started, all things Peloton during that time, but I found someone who was very knowledgeable and educated on injuries and actually helped me to strengthen and build up the muscles around my knees so that I could exercise effectively and meet my goals without hurting myself. So just a shameless plug right there for PJ. Look him up. He's on social media. Next thing is smoking. We have to, those of us who, those individuals, not us, because I don't smoke, but those individuals who smoke have to really take into consideration the importance of quitting smoking. And a lot of times it just takes a matter of figuring out why. What is the motivation behind smoking and what's preventing you from quitting? Many times there's an emotional block going on there. So we really have to do the deep work to figure out what is our attachment to smoking? What is this act of smoking taking place of? Are there any emotional blocks that's keeping us attached or, connected to this act of smoking? And what can we do next? And many times that takes doing some deep work to figure out what's going on. Maybe getting into counseling, speaking with your healthcare provider, what have you, so that you can walk through that plan of tobacco cessation or quitting smoking. Another thing is that all forms of tobacco, whether it's cigarettes, whether it's a pipe, whether it's cigars, vaping, I shared some astounding statistics on vaping a couple sessions ago and the impacts of hookah. One hookah session is like smoking 100 cigarettes. That just blew me away. But whatever the reason is that an individual is smoking, they have to be able to work through that and come up with a reason to quit smoking. They have reasons to start smoking and continue smoking, but they in and of themselves have to do that deep work to come to a decision of why they need to stop smoking. As we know, smoking causes high blood pressure, it causes heart disease, it causes damage to the arteries, it causes blood clots and a myriad of other health conditions. So we really have to do that work to figure out why smoking is such a big issue with that individual. Sleep. I don't know if I've shared it here before. Sleep is one of my hobbies, right? Whenever I can sleep, I'm going to sleep. And so this article that I read, and I was like, what? 7 to 9 hours a night is what's recommended for adults. 7 to 9 hours of sleep, good quality sleep. each night. I can be honest, if I'm being honest, and I don't get 7 to 9 hours of sleep each night. There are some nights where I may get 6. There's some nights where I may get 5. There are some nights I get maybe 7 to 8, and I have to do better with that. And speaking of doing better with that, I have to, and we have to, one of the ways that you can set yourself up for being successful with a sleep hygiene or sleep pattern is to plan, have a nighttime routine. The TV goes off at this time. By this time, I'm already showered and in bed, the TV is off. I may have some reading to do or, listen to a meditation or a prayer or journal or what have you. And then the lights go off at this time. For me, my phone was the thing that was keeping me from sleeping. It was pinging and going off, and I'm getting notifications. And I need to check this one last thing. And then before you know it, it's 1 o'clock in the morning, and I'm still on this phone. So I've put my phone in shutdown mode. That my phone goes in shutdown mode at 10 p.m. And if you are not one of my favorite contacts or important contacts, you're not going to get through to me until my phone wakes up the next morning at 7. And usually I've already gotten the phone by then, but it's still in do not disturb and sleep mode until then. And that has helped me to not be on the phone. Now I can get into it if I need to, but it takes some steps to do that. And, if I wake up in the middle of the night, because I have dealt with insomnia, not as much anymore. And I'm sure there's people, individuals watching who deal with that. First thing was to grab my phone. And so I might not be the only one who that happens to, but sleep is so important. The evening routine. And again, quantity and quality of sleep impacts the overall physical and mental health. If you have not slept, you're tired, you're groggy, you're agitated, you might want to snap somebody's head off because you don't feel well when you have not slept. And so long term, several nights and weeks of little to no sleep can definitely, or not a bad quality of sleep is what I wanted to say, can impact your overall health and your mood. The next thing is vaccination. COVID is still around, and I can just tell you about my story. I'll share and I'll be transparent. I had COVID a couple years ago, maybe 3 years ago, and I, went through the whole process. And towards the end of it, I developed post-COVID cardiac syndrome. I was having elevated heart rate, significant shortness of breath. I had swelling in my legs and my hands. I just did not feel well. My heart rate would spike up to 170s and it would stay there really prolonged. I was dealing with vertigo. Felt like somebody just jolted my body and then the whole world started spinning. And I was scared. I did not know what was going on. And so I went to see my cardiologist and he explained to me what was happening. And it was very common, which I did not know, that individuals and he said to me, it's usually young, healthy individuals who develop this syndrome, post-COVID cardiac syndrome. And so I had that, and it was a very scary time. I was able to, recover from it, but I still have not been able to get back to the level at which I was able to work out or be active as before I had COVID that first time. So we've talked about the physical things that we can do for the physical heart, ways to keep our physical heart healthy. But I want to talk about next is ways to keep your emotional heart healthy. Our emotions impact our overall heart health. If you're sad, we talked about last week the broken heart syndrome and how stress can impact that, and how love and having someone that you love or a friend or someone who cares for you around, how that can counteract the negative impacts of not having that love or dealing with a tragedy in your life or just life. Sometimes we say life is life and life be life, and that can impact your overall heart health. And so I want to talk about that stress. Stress can cause high blood pressure. It can cause high cholesterol. It can cause heart attacks. It can cause stress. And how it can cause high cholesterol is usually when individuals are stressed, they tend to eat more and they're eating more unhealthy foods, thus eating the fatty foods, which can cause the cholesterol levels to go up. Stress can cause heart attacks. As I mentioned, it can also cause strokes. And so we have to look at ways in decreasing stress. So, what is it that you need to do? Do you need to delegate? Do you need to ask for help? Do you need to step away from some things, knowing when to say no? I used to be, yes, 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 I can do that. Oh, I can help. Yeah, I got you. Yeah, I can do that. And before you know it, I'm at capacity and I have no room to do anything else, including take care of myself. And so I will always use myself as an example of how we need to take care of ourselves. And I'm speaking to you guys just as I'm speaking to myself, and that stress can have major impacts on us. And most of the time, when I'm stressed, I don't feel it. I tend to internalize stress. So I'm just going about my day, and on the outside, I look perfectly fine. But on the inside, I'm falling apart and I'm stressed to the max. I just tend to internalize it, which is not good at all. So, what is it that you can do? Um, Journaling. I love to journal, so I'm always going to mention that. Getting outside, doing things that bring you peace. For me, I love being outside. I love playing in dirt, as I call it. And that's in my garden up front, in front of my house, decorating, crafting, all things that help me when I'm stressed. Some people like to exercise. That's me. I love exercising. Some people love to, go hiking and take a walk. Whatever it is that you need to do to decrease stress, I encourage you to do that. Love more, staying connected to people and showing love and receiving love. As we mentioned last week, the impacts of love on the heart are astounding. And so that's one of the things. It can help you when you're depressed, when you're in a down mood. Love and being around people that you love is so important. Another thing is laughing often. Laughing can improve your overall mood, it can decrease stress, and it can help when you're depressed. And so taking that time to be around someone who is laughing or watching videos of things that will make you laugh will help you increase your mood, thus increasing your overall heart health, decreasing stress, and causing you to have that sense of peace and balance within your body. The other thing is practicing meditation or relaxation techniques, whatever works for you. Yoga, meditation, prayer are all things that I do. Just going outside, taking a walk, deep breathing, just practicing the act of breathing deeply, taking in those deep breaths where you're really expanding the lungs and letting the air out can decrease the blood pressure and the heart rate. Doing things that you love, hobbies, going outside, reading a book are all things that can help decrease your stress. It allows you to get away from the thing that's causing you stress and focus on that one activity for 10 minutes, 15 minutes, 30 minutes, an hour, or however long you choose to indulge in that. But those are some overall ways that we can help with the emotional heart. Our heart, many people say, I wear my heart on my sleeve. And it's almost like you wear your emotions on your sleeve, and your emotions and how you feel mentally and internally impact your heart. And so we have to take care of our whole body, the mind, the spirit, the physical body, all of that. Because when one area is out of sync, it's going to impact the other areas of your heart. So take care of yourself. Do something that causes you joy. Do something that causes you to let go of stress and have that happy countenance about yourself. I don't want you to fake it. I want it to be real, because some of us, we walk around and we're smiling on the outside and we act like we have it all together and we're falling apart internally. And so it's about the whole person, the whole man. And as a provider, I'm not just taking care of my patients' physical needs. I'm also assessing their emotional needs as well, their spiritual needs as well. And so To me, that's important. And I just want to say, I'm grateful for each and every one of you. I hope that something that I said tonight, you can take and apply it to your life, because it's so important that we take care of ourselves. And as we are coming down to the last week of Heart Health Month next week, we don't continue this, we don't discontinue or stop talking about it, because each and every day that we get up, our heart is beating. And that is something I have to be grateful for. I am grateful for that. But in that, I have to take care of this physical heart and the emotional heart. This is Dr. Latoya Wells again with Wells Legacy Health and Wellness. I am here tonight in my office. I got some patients to see. And so I just want to say, if you are in need of a primary care provider, if you're in need of physical exam, if you're not feeling well, we provide in-office visits, we provide telehealth, which is virtual visits, and we also provide convenient location visits, so we can see you wherever it's convenient with you or for you. We're located at 452 Osceola Street, Altamont Springs, Florida, Suite 106, 32701. Our phone number is 321-306-6755. And you can find us on Instagram, Facebook, TikTok, and YouTube. Stay safe and be well. This is Dr. Latoya Wells. Until next week, have an amazing evening. Bye.